The initial diagnosis really was hard for me because with retirement, I wanted to travel, I wanted to backpack, I wanted all these activities I wanted to do that I didn't have time to do when I was working all the time. I really felt that somebody took them away from me. My name is Christina. I'm 71 years old, and I found out I had osteoporosis in June of 2022. I was honestly pretty shocked because I really felt that I was doing all the things I should have been doing. In 2022, I was walking my dogs. They saw a rabbit, pulled me down, and I broke my arm. When I got my x-ray, my orthopedic doctor looked at it and said, "Oh, I think there's something going on here, some bone thinning," and recommended I get a bone density scan. And that's when I found out I had osteoporosis. I was really scared. I didn't want to do things because I was worried I might hurt myself. And so the first thing I did was start doing some research. I looked at the pros and cons of all the different things that were out there because I was pretty focused on, okay, what am I going to do? How am I going to do it? I want to get better. I want my bones strong. I want to get back to living my life. So after having done my research, I realized that EVENITY was what I wanted for my treatment because it builds bone. So when I went to my doctor to talk to him about what treatment options I had, I was ready to say EVENITY is what I wanted, but he had already looked at my chart and beat me to the punch and said EVENITY is what I recommend, and I was very, very happy. So for me, treatment with EVENITY was really easy. I was able to schedule the appointments months in advance, so I knew exactly when I was going to have them. I would go in, get my 2 shots, and out the door I went. I didn't have to think about, remembering a pill or anything else. It was easy. It was really important to have a certain amount of calcium in my diet every single day. So I started making smoothies, added more greens that have calcium, did more weightlifting. I really tried to modify my diet and my activities to things that I felt were best going to improve my bone health. I was super excited to get my next DEXA scan because I just knew I was going to be better than I was before. And I did have a pretty significant improvement for myself. After this happened to me, I made it a point to start talking to all my girlfriends. I was absolutely shocked at how many women I talked to, number one, hadn't even thought about it, didn't think it was that big of a deal, or felt, no, it doesn't affect me. And because of what happened to me, a lot of them did go to their doctor and did get a DEXA scan and did find out that their bones really weren't as good as they were and have gone on to make changes in their life. Your bones are kind of the core of your body. I don't think people realize how important it is because you don't see it, you don't feel it until something happens. And when you think about how a fracture could really change your life, everything you ever wanted to do could be taken away from you. If you are diagnosed with osteoporosis, I think it's critical that you take it seriously and do whatever you can.
Important safety information. What is the most important information I should know about EVENITY? EVENITY can cause serious side effects, including increased risk of having a heart attack, stroke, or death from a cardiovascular, heart or blood vessel problem. Call your healthcare provider or get emergency help right away if you have any of these symptoms. Symptoms of heart attack, which may include chest pain or pressure, shortness of breath, feeling lightheaded or dizzy, or symptoms of stroke, which may include headache, numbness or weakness in face, arms, or legs, difficulty talking, changes in vision or loss of balance. Before you receive EVENITY, tell your healthcare provider if you have had a heart attack or stroke, especially if it has happened in the past year. Do not receive EVENITY if you have low blood calcium or are allergic to romosozumab or any ingredients in EVENITY. Before receiving EVENITY, tell your healthcare provider about all your medical conditions, including if you have a history of other heart or blood vessel problems, have low blood calcium, cannot take daily calcium and vitamin D, have kidney problems or are on kidney dialysis, plan to have dental surgery or teeth removed. What are the possible side effects of EVENITY? EVENITY may cause serious side effects, including serious allergic reactions have happened in people who receive EVENITY. Call your healthcare provider or go to the nearest emergency room right away if you have any symptoms of a serious allergic reaction, including rash, hives, swelling of the face, lips, mouth, tongue, or throat, which may cause difficulty in swallowing or breathing. Low calcium levels in your blood, hypocalcemia. EVENITY may lower the calcium levels in your blood. Your low blood calcium should be treated before you receive EVENITY. Call your healthcare provider if you have symptoms of low blood calcium such as spasms, twitches, or cramps in your muscles, numbness or tingling in your fingers, toes, or around your mouth. Severe jawbone problems, osteonecrosis may occur. Your healthcare provider should examine your mouth before you start EVENITY and may tell you to see your dentist. Ask your healthcare provider or dentist about good mouth care. Unusual thigh bone fractures. Symptoms of this type of fracture include new or unusual pain in your hip, groin, or thigh. The most common side effects of EVENITY include joint pain and headaches. These are not all the possible side effects of EVENITY. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Ask your doctor about EVENITY. Please visit EVENITY.com for full prescribing information, including boxed warning and medication guide.
What I've learned in life, age doesn't have to slow you down. You can still get out there and do all those things you absolutely love doing